All right, so possibly the single most important thing to understand in all of clinical cognitive neurology is the difference between a rapid forgetting pattern of memory impairment and a retrieval pattern. And that's what we're going to talk about today. So on the screen here, I've got a 6-step model of memory processing in the brain, but we're going to simplify things even further for our purposes today and use a 3-step model instead, where in order to remember something, first you need to capture the memory, then you need to store the memory, and then you need to retrieve the memory later on. Now, crucially, this middle stage, the storage stage, requires robustly functioning primary memory structures, by which we mean particularly the medial temporal lobes, especially the hippocampus. With that in mind, understanding the difference between rapid forgetting and retrieval is actually relatively straightforward. So on a test of delayed recall, if someone does very poorly, and even when given prompts and cues they don't do any better, then the person is said to have a rapid forgetting profile. In contrast, if someone does very poorly on delayed recall, but their performance significantly improves with prompts and cues, then they have a retrieval pattern. And this should actually make relatively intuitive sense. Consider, for example, the person who has a rapid forgetting profile. If they've quite literally rapidly forgotten the information that they learned a short time earlier, then that information is no longer anywhere in the brain. It's literally been rapidly forgotten. So of course, no amount of prompting or cues is going to help that person remember that information. It's no longer there. It's not in the brain anymore. In contrast, someone with a retrieval pattern, their primary memory storage structures are working okay. That storage stage of memory processing still occurred, and the information did make it into long-term memory. It is there in the brain somewhere. The person's just having difficulty retrieving it. They're having difficulty accessing it. But because it's there somewhere, of course, prompts and cues will help. Now, distinguishing these two patterns of memory impairment is usually relatively straightforward using the widely available cognitive screening instruments that many people are familiar with, like the MOCA or the Addenbrooke's cognitive examination, all of which will have some kind of version of a verbal learning and delayed free recall task like this, where firstly a person is asked to learn, say, 5 words, and ideally they're given the 5 words a number of times with a number of trials to make sure that they successfully register all the information to give them the best chance possible. And then after a period of time, after a delay, they're asked if they can remember any of the words in whatever order. And firstly, their free recall is assessed, where they're not given any clues. And if they're having trouble, then they might be given firstly a category cue. So for example, for tiger, they might be told one of the words was an animal. And if they're still having difficulty, they might be given multiple options to choose from, a multi-choice cue. It was either a tiger, a lion, or a leopard. So with that in mind, let's have a look at these two patients and compare their performances. So this first person has done quite poorly on their delayed free recall. They've only got 1 out of 5. However, of the 4 items they didn't get, 3 of them they immediately and confidently get when they're given a category cue. And then the one remaining item that they still haven't got, they immediately get when given multiple options to choose from. So they've done poorly on their delayed free recall of 1 out of 5, but their performance has dramatically improved with prompts and cues. So this is therefore a retrieval pattern. In contrast, this person down below, they've also done poorly on their delayed free recall, scoring 0 out of 5. And this hasn't improved at all when given category cues, still 0 out of 5. And on given multiple options to choose from for each item, it still hasn't improved really at all, except for 1. So overall, this person has significantly impaired delayed free recall, which isn't improved with prompts and cues, And so they therefore have a rapid forgetting pattern of memory impairment. Now, it's important to realise that although the cognitive screening instruments really emphasise verbal memory in their assessments, we can make this distinction for non-verbal memory as well, and it's actually relatively straightforward to assess non-verbal memory in this way, at least informally. And to do that, all we need to do is recognise that almost all of the cognitive screening instruments require a patient to draw something at some point during testing, such as a clock or a cube or pentagons. And so what we could do, something easy we could do, is just at the end of testing, ask the patient what it was that they drew earlier. So for example, if they drew a clock, we'd ask, what did you draw earlier? And if they weren't sure, what we could then do is give them a cue by drawing a circle. If they then saw the circle and immediately said, oh, that's right, it was a clock, or better yet, went on to just draw the clock, then that would represent a retrieval pattern for non-verbal information. In contrast, if despite being shown this visual cue in the form of the circle, they still didn't really know, and perhaps they said, oh, was it a wheel? Then that would suggest a rapid forgetting pattern of memory impairment for non-verbal information. Now, where this is potentially a little bit useful is that if we accept a simplified model where verbal memory lateralizes more to the dominant hemisphere, usually the left hemisphere, while non-verbal memory lateralizes more to the non-dominant hemisphere, usually the right hemisphere, then if someone had rapid forgetting for both verbal and non-verbal information, then that would suggest impairment of the primary memory structures in both hemispheres, suggesting a bilateral process was going on. To bring this all together, though, I like to think of the hippocampus, the primary memory structures, as playing a role where they have to rubber stamp memories before they're approved for long-term storage. If the hippocampus isn't working properly and this approval process can't occur, then the memory can't be put into long-term storage and it just kind of dissolves, or maybe it's put into the shredder and is rapidly forgotten. So rapid forgetting suggests impairment of the medial temporal structures, particularly the hippocampus. Whereas a retrieval pattern localizes more to, say, the frontal lobe or a process affecting the subcortical structures, or maybe even a more generalized process affecting, say, the white matter, like chronic small vessel ischemic disease. In terms of more specific differential diagnoses suggested by each, in the appropriate clinical context of particularly an older person presenting with a slowly progressive memory impairment, rapid forgetting suggests Alzheimer's disease, Alzheimer's disease, Alzheimer's disease, Alzheimer's disease, whereas a retrieval pattern is sort of everything else. Now, in reality, the list for each of these categories is a little bit longer. I won't go through all of these now, of course, but I'll just draw your attention to the fact that when we look at all of the conditions that usually give you a rapid forgetting pattern of memory impairment, the thing they have in common is that they affect the mesial temporal structures and therefore the primary memory storage structures. In contrast, it's useful to divide the specific differentials for a retrieval pattern into three categories. We have our general medical conditions that we often screen for when assessing someone with a memory problem that give us a retrieval pattern, because of course the primary memory structures are unaffected. Similarly, severe psychiatric disorders resulting in memory problems will also give us a retrieval pattern, as will primary neurological disorders that don't affect the primary memory structures, but rather affect other areas of the brain, such as, for example, the subcortical structures, like in Huntington disease or Parkinsonian syndromes, or more diffusely affecting the white matter, like chronic small vessel ischemic disease in vascular cognitive impairment, or demyelination in, say, MS or something like that. So there you have it. That's the difference between rapid forgetting and a retrieval pattern of memory impairment. Poor delayed recall that doesn't improve with prompting suggests rapid forgetting, implying pathology in the medial temporal lobes affecting the primary memory structures, and in the right clinical context suggests Alzheimer's disease. In contrast, poor delayed recall that does significantly improve with prompting suggests a retrieval pattern and implies an issue with the frontal or subcortical structures, or perhaps a more generalized process. That's where we'll leave it for today. In the future, I would like to talk about a couple of more nuanced complexities regarding this distinction, but if you just understand what we've talked about in this video, then you'll already be well on your way to being an expert in cognitive assessment.